Your labs aren't lying to you. Your test panel is just too small. I've watched this exact pattern in patient after patient. A normal result on paper and a very real set of symptoms in the room with me. You can have a real thyroid problem and a textbook perfect TSH. That's not a contradiction. That's just what a narrow test looks like. This is what got ordered. This is what I would love to have added, but wasn't added. 8 tests that standard panels routinely skipped and exactly what to say to get them. I'm a real licensed doctor, and I've lost count of how many patients hand me a normal lab report while feeling anything but normal. I've come to the point in my career where I order whatever any patient needs from me, and I go beyond standard conventional medicine with functional ranges and tests that most conventional doctors never know to use. Up first, the 4-test thyroid problem. Most thyroid panels stop at one number, which is thyroid stimulating hormone. TSH is a pituitary signal. It tells your thyroid how hard to work. It's a good standing test, it's just not the whole conversation here. Here's the chain most panels skip. Your body converts T4 thyroid hormone into active T form of T3 that your cells use. Some of the conversion gets rerouted into a less active form called reverse T3. Run that high and your tissues can be starved for unusable hormone even while TSH looks perfect. And a 2025 study followed patients treated with hypothyroidism who still felt exhausted despite a normal TSH. Reverse T3 was elevated in almost 21% of those on a standard T4 only medication versus about 3.5% on a different form of replacement. The authors of the study were real careful here, and so am I. This doesn't prove reverse T3 causes the fatigue. It's a signal worth investigating, not a diagnosis by itself. And what to ask for from your doc: free T3, free T4, reverse T3, and thyroid antibodies, not just TSH alone. Next, the decade early warning sign: fasting insulin. Most annual physicals check fasting glucose, sometimes an A1C. Both look at sugar in your blood after the pancreas has already worked overtime to keep that number normal. Insulin is the hormone that pushes sugar out of your blood and into the cells. Early on, your pancreas compensates by pumping out more and more insulin. Glucose stays normal because insulin is doing its extra work behind the scenes. And a 2024 review found that fasting insulin and a related calculation called HOMA-IR can lead to compensation years before glucose levels move, potentially 10 to 20 years before type 2 diabetes diagnosis. And you see, that's the whole point. By the time glucose looks abnormal, the compensation has already failed. And here's what you need to ask for: fasting insulin alongside fasting glucose, not just glucose alone. Then you may have heard of the normal CBC or complete blood cell count, lab trap, ferritin, and the full iron picture here. Standard CBCs check hemoglobin, the protein that carries oxygen in your blood so you can breathe properly. It does not check ferritin, your iron storage tank. You can run your iron stores down for a long time before hemoglobin ever dips. Hair falls out, energy drops, brain fog sets in, and the CBC still reads normal. Research shows iron deficiency without anemia happens at least twice as often as full-blown iron deficiency anemia. And this is largely because standard screening leans on hemoglobin instead of ferritin. So what do you ask for from your doctor? Ask for ferritin, iron, total iron binding capacity, not just a CBC here. If you're realizing you never actually have seen your ferritin number on a lab, that's exactly the kind of gap a longer conversation can close for you. That's what our Wellness Plus virtual visits are built for, going category by category through what's missing. The link is below if you want to book one. Now, here's the double-edged test: an ANA, an anti-nuclear antibody screen. ANA looks for antibodies in your immune system. It makes them against your own cells. It's a general kind of autoimmune activity. But here's the twist that nobody explains. ANA is a very sensitive test, meaning it catches a lot, but it's not very specific, meaning a positive result shows up in plenty of healthy people too. One review puts it plainly: ANA stays the right first screen for autoimmune disease, but a positive result has to be read alongside titer levels and actual symptoms. So not treated is good enough alone here. So if you've tested ANA positive and been told it doesn't mean anything, that's not quite right either. It means something, just not everything here. So what do you ask for from your doc? Here's what I recommend: ANA reflex testing, which means a tighter and specific antibody panels. If ANA comes back positive, especially ask for this extra test. This one's close to my own lane, itchy, foggy, flush enzyme DAO. DAO is the enzyme that breaks down histamine in your guts after you eat. When DAO activity runs low, histamine builds up, and you get symptoms that look like allergies without a clear allergic trigger. So think hives, flushing, headaches, foggy thinking after meals. One study of 316 patients found DAO activity was significantly lower in people with suspected histamine intolerance than in healthy controls. When a subset followed a histamine-restricted diet for several months, symptoms ceased and they eased, and DAO enzyme activity rose. Other research since backs up this, but adds a caveat worth saying out loud here. DAO testing works best paired with a supervised elimination trial, not read alone by itself. So what to ask for? Serum DAO activity alongside a conversation about a histamine trial, not instead of one. So here's the test everyone sells. Most people think a food sensitivity blood test can tell them exactly which foods are hurting them. Here's the honest answer. For the most common version of that test, IgG4 food antibodies, it can't. IgG4 antibodies show up when your immune system has been repeatedly exposed to a food that has learned to tolerate it. That's the opposite of a reaction. It's your body struggling, not flagging a problem. The major allergy societies, AAAAI and EAACI, reviewed the evidence and concluded these panels are irrelevant for diagnosing food allergy or intolerance. A positive result showed up constantly in people with zero symptoms. And I'll say the quiet part out loud here. These panels get sold as a shortcut, and the shortcut doesn't hold up. The real gold standard is slower and less profitable to sell. A supervised elimination and reintroduction trial, tracking symptoms as the foods come in and go back out and go back in. What to ask for is a structured elimination trial with your provider, not a commercial IgG panel as your only evidence. Same honesty, different test here. Urine mycotoxin testing for mold exposure. So mycotoxins are toxins produced by certain different types of molds. The idea behind the test is very simple. Measure them in urine, prove exposure. Here's the number that means nothing alone. The CDC is direct about this. There's no FDA-approved test for mycotoxins in human urine, and no established level that reliably predicts illness. Mycotoxins turn up in healthy people from ordinary diet, not just a water-damaged building. And us as functional doctors are pretty direct about that. So what does that mean? A positive result alone can't tell you if you're looking at breakfast or a moldy basement. It needs context, symptomatology, environment, sometimes an actual inspection in the home. Some of these tests get sold as clean proof, and they're not, they're nuanced. And you deserve to know that before you spend money on one side. So what to ask for from your doc? A mold exposure test interpreted alongside symptoms and environmental history is super imperative, not a number just in isolation. So you're probably wondering, what's the actual list I take to my doc? Bring this written down to your next visit. For thyroid symptoms, ask for free T3, free T4, reverse T3, and thyroid antibodies, not TSH alone. For unexplained fatigue or strong family history of diabetes, ask for fasting insulin alongside fasting glucose. Hemoglobin A1C is worthy too. For fatigue or hair loss with a normal CBC, ask for ferritin and a full iron panel. For unexplained joint pain, rashes, and fatigue, ask for an ANA with reflex testing if it's positive. For hives, flushing, or foggy thinking after meals, ask for a DAO enzyme and test DAO paired with a real elimination trial. For suspected food reactions, ask for a structured elimination and reintroduction trial before you pay for an IgG panel. And for suspected mold exposure, ask that any urine mycotoxin result be read alongside your symptoms and your environment, not just on its own. You don't need to diagnose yourself with any of this. You need the words to start the right conversation. And now you have them. Normal labs don't mean there's nothing wrong. They mean the test you were given wasn't built to find exactly what's happening. 3 things to remember. TSH alone doesn't clear the thyroid. A normal CBC doesn't clear iron. And not every test sold to this community holds up against the scrutiny. Bring the list from this video to your next appointment and ask for what's missing by its name. If brain fog is a symptom that brought you here, I've got a full breakdown of that coming, and I'll link it as soon as it's up. If this changed how you think about your own normal labs, book a Wellness Plus visit or visit with my virtual clinic. That's exactly the conversation we're built to have here. And if you want more of this honest, specific, no fluff, then subscribe. That's the whole channel and why I'm here.